The Russian Influenza Pandemic of 1889 by Brittany Connor. The origin of the outbreak. The Russian influenza, also known as "la grippe", which is French for influenza, was thought to have originated in Central Asia, lightly affecting northern India and Siberia for 6 months. It hit its peak in St. Petersburg, Russia in November of 1889. Within weeks, the disease started moving west into Europe and next the Americas. Within 4 months, the disease had made its way around the world. People saw the disease as one of the largest and most tragic to ever hit the entire world. The mortality ratios ranged from 0.1% to 0.28%. How the disease was interpreted. People saw the disease as one that the world as a whole had not experienced because of how rapidly it was spreading. The influenza disease was thought to have been caused by a few different things. Some people thought that the disease was being spread by infected cattle during the rise of the culling operations. Physicians understood that the disease was spread through human contact, so they encouraged people to distance themselves as well as to not have contact with objects that were in direct contact with others. The disease was also thought to have been caused by atmospheric conditions such as temperature, by one doctor in particular, Dr. John Moore of Dublin, who encouraged his patients to stay indoors. Influenza today. Up until the beginning of 2020, influenza was not as deadly as it was in the 1800s, but was still something that the people took precaution with as to not catch. In mid-March 2020, COVID-19 became the next deadly pandemic to hit the world. Unlike the flu, there were no vaccines or real knowledge of the virus. The common symptoms of the Russian flu were fevers, fatigue, head and body ache, as well as hot and cold flashes. In COVID-19 cases, people experience the same symptoms at a higher degree. The new disease also showcased a new symptom, loss of taste and smell. Influenza treatment. Since there was no known cure for the influenza outbreak in the late 1800s, the most common treatment used was to treat the symptoms individually instead of the disease itself. For example, when it came to managing hot and cold flashes, doctors would suggest patients either keep warm or cool down. Doctors rarely prescribed medications, and if they did, it was to those with severe cases. For example, doctors prescribed antipyrine and quinine to act as sedatives. More complicated and debilitating cases were treated with stimulants. Today there is still no real cure for the flu. The most doctors can do is prescribe pain and fever-reducing medications as well as rest. There is a sense of preparedness when dealing with influenza. One being taking preventative measures such as the influenza vaccine and social distancing. Influenza in society. During the Russian flu outbreak, health officials began to use statistics and other data to improve public health by geographically identifying cases and deaths. We saw the same method used in mapping out the COVID-19 pandemic. Today, the general influenza disease is viewed as a modern issue in society. This changed during the COVID-19 pandemic. It has caused people all over to take necessary precautions and preventative measures. Those precautions include face masks, social distancing, and quarantining. The Russian influenza pandemic overview. Although the Russian influenza pandemic of 1889 was a very tragic time in history, it also brought about methods on how to treat, monitor, and prevent the influenza virus. These methods are still widely used today, over 100 years later. References